All right, man, welcome back to Level the Playing Field, talking about sports medicine. Today I have a very important topic I want to go over, and that's the role of mental health as it pertains to sports medicine and sports injuries. So follow along, like and subscribe. Let's get on into it. So sports injuries are devastating from so many aspects of life. Depending on what sport you're playing or what that sport means to you in your life, if it means it's just a role of relaxation or leisure, if it's something related to like a scholarship for school, for some people, of course, it's a profession for professional athletes and performers. Sports injuries really can derail all of that. And as you might imagine, there's really a big role for mental health as it pertains to that. So anything affecting your body is going to affect your mental state. And we know increasingly about the importance of the mind-body connection. Everything that happens throughout you affects your mind up here. One thing that we haven't necessarily, I would say, always focused on that we need to more, and increasingly we are, is the role that mental health plays when coming back from an injury from sport. I always talk about ACLs, so we'll talk about that as an example. After an ACL injury, a lot of patients will experience something called kinesiophobia, and that's a fear of movement. So if we break that down, what that means is that your body has developed sort of an anxiety as it relates to what happened to your knee. What we don't always, fully comprehend is that an injury to the knee, like an ACL tear, is a life event. All right, that's a big deal to your body. It's a big deal to your knee, and it's traumatic. It's traumatic to your body, and just like anything else in your mind that your body processes as traumatic, it leaves an effect on you that can affect some people more than others, but most people have some kind of effect from it. So after ACL injury, for those who are treated either surgically or non-surgically, the recovery process, it entails rehabilitation, getting your knee moving again, getting your knee strong again. That process is daunting. It's time consuming. It takes time away from school. It takes time away from work. It takes time away from family. You need the support from your family. You need support from loved ones. It takes a lot to it, right? And just the stress from that is enough to really weigh on someone's mental health. But that aside, the actual act of injuring your knee actually, like we said, leaves an imprint on your mental psyche that can last even beyond, finishing your rehab. So a large reason for some people coming back after an ACL injury and some people not making it back relates to mental health. It plays a big role in that. So a patient, and I've seen this before, can get all the way through their rehab, get to where their knee is moving by, orthopedic or let's say mechanical standards perfectly. They got full motion of their knee, their strength has returned, they're even demonstrating an ability to run and cut and pivot. But they still can't make that mind-body connection. And that's that kinesiophobia. That's interfering with their ability to fully trust that knee. And really what it comes down to is a sort of anxiety or a traumatic response to what happened to you when you first got injured, and your body is responding to that, as such. That can be a very difficult obstacle or hurdle to overcome for an athlete. It can be very frustrating to on one end see that, hey, the knee's been fixed. We've done what we needed to do to get the knee moving again. We've gotten it strong again. We've shown that you can do some movement, but still not be able to go back to doing those activities that you love or you need to do. And that kinesiophobia, that fear of movement, is playing a role in it. Increasingly, we've been trying to create more of a multidisciplinary team when it comes to sports medicine to try and address this. So we've always talked about how sports medicine is a team effort, right? It's not just the doctor, it's the doctor's surgical team, it's the doctor's clinic team, it's the physical therapists, it's the athletic trainers, it's strength and conditioning coaches. The list goes on. It's your family members, it's the people you care about, it's everybody, right? It's a team effort to bring somebody back from an injury. But what often has been left out of that team is mental health providers. And we need that. We need to get better about that because we're seeing too many young athletes not get back to their full potential or even have long-term problems related to their injuries because they're not getting the mental health help that they need. It really needs to become the standard of care that there is some access or involvement of, say, a sports psychologist, counselor, mental health counselor involved when people have serious injuries. Having somebody who can really help you make that connection, right? And be a part of your team and be connected with those who are helping you with the physical parts of your injury and relating that to how it affects your mental health is key. To be able to break down that process within your mind and have someone help you through that process is important. And later on down the line, we're going to have some sports psychologists on here to help talk about what are the pieces to make that connection and to overcome those obstacles and hurdles. But it's very important that we kind of raise our awareness about the importance of access to adequate mental health as it pertains to sports injuries. And it's only when we make that connection that we'll see as many people come back from these serious injuries as we possibly can. So keep that in mind. Remember, the mind-body connection is absolutely crucial for returning from a serious injury. And remember that there's more to it than just what you see physically. Also, remember to keep that compassion on your end. So we know if someone gets injured, there's a lot going on for them that you may not be experiencing or be able to see. So know there's a lot going on for that person, and keep that compassion and empathy whenever you're interacting with someone who's been through that. So we're going to continue to bring this great sports medicine knowledge to you here at Level the Playing Field. We'll see you next time. Please like and subscribe for more content just like this. Take care.